Hi, my name's Dr. Steve Jones and I'm a clinical psychologist working in Sheffield Children's Hospital. Today, I wanted to talk to you about something that we call long-term health conditions. A long-term health condition is a health condition that lasts over a period of months, years, or a lifetime. Sometimes you might hear the words chronic health condition, and that means exactly the same. The word chronic relates to time. It doesn't tell us anything about the severity or intensity of the health condition itself. And this is why the words long-term or chronic can be used interchangeably by medical professionals such as doctors or nurses. It's estimated that around 1.7 million young people in the UK have been diagnosed with a long-term health condition, such as cystic fibrosis, asthma, diabetes or epilepsy. And there are lots of other long-term health conditions too. This is important to know, as young people often tell us that they can feel different or alone with their long-term health condition. And while this feeling can be very real and can still be very difficult, it's important to know that you're not alone. Not all long-term health conditions are the same. Some young people are diagnosed with a long-term health condition when they're born, such as often young people diagnosed with cystic fibrosis. Some long-term health conditions develop naturally during childhood or teenage years, such as type 1 diabetes. And in some cases, a long-term health condition can come about suddenly, such as long-lasting pain caused by a serious injury. This means that for some people, they have only ever known having their long-term health condition, whereas other people have them come on more suddenly when they're older. Some people's families will have others diagnosed with the same or a different long-term health condition, and some people will not. It's important to know that everyone will manage their own life and their own health conditions differently. Some people may need to take lots of medications and treatments daily, while attending frequent hospital appointments, and that can impact on things like school attendance or being able to do certain activities. Some people may have less medical input when they're well, but then can have flare-ups, which can mean they need intensive treatment at that time. No two people are just having a long-term health condition in the same way. Often, young people can feel angry, frustrated, upset due to their diagnosis, or the treatments and procedures that they may be asked to do. That's completely understandable. There can also be feelings of resentment and distress in relation to medical professionals who are trying to help, but who you might not want to see because they're a reminder of your health condition. These feelings are often most intense around times of change or transition, such as immediately after diagnosis, or changing schools or friendship groups, or times when our friends start to do activities or have freedoms that aren't possible due to the nature of a specific health condition. It's important to understand that whatever you feel, it's okay to ask for support. If you find that you're feeling anxious, worried, upset, low, depressed, or any other emotion that you find difficult due to your long-term health condition, then it's important to speak to an adult that you trust. This may be a parent or a teacher at school. Or if you feel like you'd like some more support with these feelings, then please speak to your doctor or nurse about speaking to us, a member of the paediatric psychology team. We're here to offer non-judgmental and confidential support to young people within Sheffield Children's Hospital with difficult thoughts or feelings in relation to their health. And we welcome referrals from within the hospital. And thank you for listening to this information, and take care.